Hi everyone, this is Ryan Valenciano here to do some mid and lower cervical tests. Now last time we did upper cervical tests, but now we're going to be checking for the full range of motion for our client's neck. For these tests, we're going to be doing active range of motion for flexion, extension, lateral flexion, and rotation. For this, it's important to determine whether or not we can perform overpressure, which is to be done if the client can reach a full range of motion pain-free. So let's take a look. So, Brian, let's go and do some exercises. So, can I have you bring your head forward and down as far as you can? Any changes with this?
No.
I'm going to go and apply some pressure. Is that all right?
Yes.
All right. Any changes?
No.
And relax. For this one, can I have you bring your head all the way up to the ceiling? Great. Any changes here?
No.
Okay. Going to apply some overpressure.
Okay.
Any changes?
No.
All right. And relax. Now, can I have you bring your left ear to your left shoulder for me? Okay. Any changes to this?
No.
How about now?
No.
All right. And relax. And we'll do the opposite side. Right ear to right shoulder. Perfect. Any changes?
No.
All right. And relax. Next one, can I have you turn your head to the left without moving your shoulders? All right. Any changes?
No.
Okay. Going to apply some overpressure. Any changes?
No.
Great. And relax. We'll try the other side. Any changes here?
No.
And we'll add a little bit more motion. Any changes?
No.
And relax. So that's it for the active range of motion. Remember, we're looking for QQW, quantity, quality, and a willingness to move. That's it for now. I'll see you next time. Hi everyone, this is Ryan again, and for this one we are going to be taking a look at the active range of motion using our inclinometers. Now this is a dual inclinometer system, and the reason why we're using two instead of one is because we want to see how much motion is going through the cervical portion of the neck rather than the thoracic segment. So if we look at the difference between these two, we can go and add or subtract respectively to see whether the motion is coming from the cervical region or the thoracic region. So for flexion and extension, we're going to be having one of our inclinometers out here on his T1, and that's why I've asked my client already to take off their shirt, providing them with as much privacy as I can, and the other inclinometer over here, and asking them to go through their active range of motion. So Brian, can you go and lean your head forward for me? Is that as far as you can go?
Yes.
Perfect. So you can relax. Now when we do extension, we don't want their head to bump into the inferior inclinometer. So we're going to go and move it over while maintaining the same position at T1. So Brian, can you bring your head back for me? As far as you can. Great. And relax. Lastly, we're going to be doing some lateral flexion. So for this, once again, we're going to be looking for T1 to see where the motion is, and having our other inclinometer on his head, so. And Brian, can you lean your head to the right? Perfect. We're going to be checking for both numbers, and relax. And once again, can you bring your head to the other side? And once again, checking for both numbers, and relax. Remember, active range of motion is used to check for QQW, quantity, quality, and willingness to move, and these measurements should be compared to your passive range of motion for the client to see what their limitations are. That's it for now. I'll catch you guys later. See you. Hi there, Ryan here again, and this time we're going to be doing rotation with an inclinometer. So just like we did with the other inclinometers, we're going to go and zero this one out, but notice we only have a single inclinometer as opposed to double. This is to go and allow us to go and check for cervical rotation, and unlike the other motions, we're not as concerned about isolating the thoracic motion. So we'll have it on our client's forehead. And Brian, can you go and turn your head to one side for me? Perfect. We're going to check that out. And relax. can you turn your head to the other side for me? Perfect, and relax. And that's it for now. Remember, active range of motion, we're going to be checking for quantity, quality, and a willingness to move. That's it for now, so I'll see you guys later. See you. Hi everyone, it's Ryan here again. So now we're going to be doing passive range of motion with a goniometer this time. And the reason why we would go and use a goniometer as opposed to the inclinometers that we were using earlier is we want to think about what is the appropriate position that a client can get into for them to be safe and be able to perform these tests accurately. So passive range of motion is very important as we're trying to compare the results that we have from active range of motion and see how these differ so that we can see what their actual limitation of movement might be. So for this, we're going to be having our arms for the goniometer moving according to the head motion. So Ryan, can you turn your head to the left for me? All right, great, and relax. And now, can you turn your head to the other side for me? Great, and relax. And that's it for the goniometer. We want to look for symmetry in motion and see if there's any differences between the two. I'll see you again soon, so catch you next time. Hi everyone, this is Ryan again, and now instead of active range of motion, we also want to make sure to test our client's passive range of motion. This allows us to give us a comparison between that and the active range of motion and feel the end feel of it, checking to see if there's any abnormalities that we might not suspect. So for this one, we're going to be working with our client in flexion, extension, lateral flexion, and rotation. So first of all, we have the table propped up in a way that keeps our biomechanics safe so that we don't injure ourselves as well. Brian, could I have you have your arms to your side? Thanks for that. First up, we have flexion. So unlike the upper cervical motion, the mid and lower cervical motion, we want to go past that first end field. So let's try this. And any changes? Okay, and relax. Now we're going to go into extension. I'm going to bring you back. Ryan, any changes? Okay. Rotation. Going to bring him all the way through the total range of motion. Any changes, Brian?
No.
As we're doing rotation, we want to make sure that we check his shoulder, that it's not hiking up. Brian, any changes with this?
No.
Okay. And lateral flexion. Brian, any changes?
No.
Okay. Any changes? Okay. Here we go. And that's it for now. I'll see you guys next time. So, catch you soon. Hi everyone. For this last skill, we're going to be taking a look at some cervical down glides. So for this, what we're going to be checking are the facets from C2 to C7. We're going to be checking for any pain or asymmetrical movement and trying to see if we can locate if there is any deficits that we might be expecting. So for this one, we do want to make sure that we have our client well supported using our stomach. So Ryan, can you relax? So you want to have your client in a as relaxed position as possible to bring them into a little bit of flexion, and you're going to stabilize yourself having one leg back. Now, using the metacarpal of your second digit, you're going to be pushing into them to create a slight glide. And we're going to be looking for C2 and moving our way down as soon as we find one. And just creating enough pressure so that we're not choking our client. We're going to bring our client back down. And that's it for our last skill. I'll catch you guys on the next segment, so I'll see you later. Thank you.